Good evening, everyone. My name is Scott, and I'm the Chief of Staff for Congressman Larson's office. Thank you for joining our Tele Town Hall. This evening, we'll be discussing the coronavirus. This is an interactive forum, and we would love to hear from you. We will take as many questions from constituents as possible. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed into line to speak with a member of our staff. They will take down your name and a brief summary of your question. The next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly. We will do our best to answer every question as possible this evening. We receive a lot of questions on our live events, so if we're not able to address your question, please leave a voicemail after the events. Again, if you have any questions throughout the events, please press *3 on your keypad, and we will put you in line for a question. Now I will turn it over to Congressman Larson.
Well, thank you, Scott, and thank everybody on the line for joining me on this Tele Town Hall. We frequently do forums and town hall conferences across the district, but given the nature and the concern of the coronavirus, we feel good that we're able to employ technology. I am speaking to you from Washington, D.C., where we will be voting shortly on another package of relief that we believe is common sense. We hope we are able to answer questions that you may have about the coronavirus, also known as COVID-19. And as Scott stated, we have an open line for questions, which, if you have one, please press *3. I would like to first start by sharing the latest we know about COVID-19 and its presence in Connecticut and the United States. As of now, according to the CDC, the Center for Disease Control, and this information is constantly changing, there are 1,215 cases in the United States and have been 36 deaths from COVID-19. 42 states and the District of Columbia are reporting cases. In Connecticut, there have been 6 cases of people testing positive for COVID-19. For the latest information, I would encourage everyone to check both the Center for Disease Control and Prevention at cdc.gov's website, as well as the Connecticut Department of Health's website at ct.gov/coronavirus. The federal government and the state of Connecticut and the Congress are taking the coronavirus very seriously, and I would encourage everyone to do the same. That does not mean, and I can't underscore this enough, that does not mean panicking. In fact, it means quite the opposite. It simply means taking common sense steps in your life to protect your health, your loved one's health, and your friends and neighbors' health. First, remember what your mother taught you. Please wash your hands with soap and water frequently and for at least 20 seconds. COVID-19 spreads mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. If you don't have soap or water, and I can't tell you how many times I've used Purell in the last several days, use a hand sanitizer that contains at least 60% alcohol. And try as much as you can to avoid touching your eyes, nose, and mouth. Avoid close contact with people who are sick, and if you yourself are sick, stay home from work and other activities. We have heard from Dr. Fauci today, the head of the National Institute for Allergies and Infectious Disease. And what he said was very sobering. He said this disease is going to get worse. We see that as it exponentially grows every day. All the more reason to take caution and listen in and consult the various websites as we go forward. If you are sick with symptoms that are like COVID-19, a fever, dry cough, please call your doctor or the Connecticut Department of Public Health at 860-509-8000. Again, that's the Connecticut Department of Public Health at 860-509-8000. If you have general questions, please call the helpline 211. Again, for general questions, dial the helpline 211. They will be able to direct you on the steps to take to get tested, to take care of yourself, and of course to protect others. I would also like to let you know that we are taking steps in Congress and are attempting to provide the resources necessary to fight this epidemic. Later this evening, the House of Representatives will pass a bill to provide assistance. First and foremost, this bill ensures that COVID-19 testing for every American is free. Let me repeat that. If you've got symptoms, what we absolutely want is for you to contact the appropriate authorities and go for the testing because it's free. No copay, no ifs, ands, what, or buts. It is free. Additionally, this bill ensures people are able to take care of themselves and their family if they get sick, including expanding sick pay for workers, ensuring there is paid leave for those who have lost their job because they or their family member has contracted COVID-19. Last week in Congress, we passed and the President signed into law an $8 billion emergency spending bill. This provided $6.2 billion to the Department of Health and Human Services, including $2 billion for vaccine development and therapeutic development. There was also $1.9 billion for the CDC. This bill also allows for an estimated $7 billion in low-interest loans to affected small businesses. And we've heard from some already about this concern, and we want to make sure we're able to work with you on this. Additionally, we've taken preventative steps. Back in 2019, we have sponsored the Family Act, which is led by our own Rosa DeLauro, which would create a new federal earned benefit that would guarantee workers paid family and medical leave. And as part of the Families First Coronavirus Act, there will be a limited version of the Family Act to provide coronavirus-related paid leave. We have also sent a letter to President Trump and the Department of Health and Human Services to ensure that future COVID-19 treatment or vaccine is available for an affordable price. We also voted to make sure that the Coronavirus Preparedness and Response Supplemental Appropriations Act provides the kind of funding that's going to be necessary, especially making sure that that funding gets back to our states and to the appropriate impacted agencies. And later this evening, we expect to go back in and vote approximately around 8 o'clock this evening to vote to make sure that we're putting people first, especially as it relates to getting tested if you have those symptoms, which is vitally important, and to make sure that everyone understands that will be free. We will continue to follow up, and we'll have another telephone town hall on Monday, because as was indicated, we anticipate, as other nations have experienced, that this virus will continue to grow, and we want to continue to reach out to as many people as we can. At this time, we're going to open the line for questions. I would like to point out that I'm not a doctor or a physician, but hopefully we can provide you with the responses that you're looking for and direct you to the agencies that will be most beneficial in helping you with your concerns. So at this time, let us open it up for questions, and thank you all for joining me for this Tele Town Hall.
Thank you, Congressman. And as a reminder, at any time during the call, you can press *3 if you'd like to ask a question, and we will get you in the queue. So our first question comes from Ken, who has a question about advice for how teachers should handle this epidemic. And if Ken, if you can just mention what town you're from. So Ken, you are live with the Congressman.
So, Congressman Larson, I'm a special education teacher from our congressional district in Connecticut. The past few days, my students have been quite worried and upset due to the coronavirus and the media panic surrounding it. What advice would you give to teachers across our state for the coming days and weeks to reassure students and parents who are anxious about the disruptions to their educations and lives?
Well, first of all, what I would do is contact, as we said earlier, the Connecticut Department of Public Health. And as you know, as a teacher, it's the state of Connecticut that regulates our education system. Clearly, again, we don't want to sound the alarm of panic, and certainly the goal here is to make sure that we're compensating states and appropriate agencies with the money that they're going to need, or impacted families who would need sick leave for a child who needs to stay at home. Now, from a good news perspective, the children are least impacted and are more resilient to the coronavirus. The elderly are the most vulnerable in this case. Having said that, however, we want to make sure in all instances that we're following all protocols, including those of hand washing and Purell, etc. And as you're probably aware, a number of schools are already taking the action through their local boards of education or through their various towns of making the decision to close school. We also recognize that will create a further problem for people in terms of children at home alone, and we want to make sure that we're following through on that and providing all the assistance that we can. But when you listen to the nightly news and see that the NBA and the NHL and Major League Baseball are being closed down or opening later in the case this, you understand the primary concerns is avoiding crowds. And, of course, being a school teacher, you're in a crowded classroom every day. And so these are decisions that have to be made at the local school level as our system of government dictates. And it's up to us and the Connecticut Department, it's up to us to make sure we're supplying the supplemental funding that is needed, and up to the states to make those specific decisions in guidance with their Department of Public Health.
Well, thank you. Now we'll go to Jim, who's going to ask about tests. And Jim, if you can just mention what town you're from. You're live with the Congressman.
Hi, I'm Jim. I'm from Middlefield, Connecticut. The last few days I've been very upset about the lack of test materials to test people, and also the lack of laboratories that are certified to run the test in the time that it's going to take to get these back. I really would like to know what's being done about that.
Yeah, and so are we. And from the outset, this has also been my concern, and every health professional that I've talked to, and every letter that we've written to the administration has been focused on the diagnosis. And as you are rightfully concerned, that is the number one issue. Now, to be fair, we have never encountered a virus like COVID-19 that is spreading as quickly as it is around the world, and with serious consequences for about 20% of those who are affected. That said, I would like to see more tests distributed faster around the country. The president, though he made statements last night, we're still checking to see if those tests, and we understand that Connecticut is prepared to do more, but we didn't really have a good handle on this virus and its spread, and we won't until we have testing that takes place widely. There's also, if you've been listening to the public accounts over the airways today, concern about developing a test that's speedier than the process, as you pointed out, with a certain amount of frustration that our labs currently employ and use. When you turn to a nation like South Korea and see what they've been able to do, this is the United States of America, and we ought to be able to look at the appropriate protocols and without risk get these out in a timely basis so that we're doing more testing. As of this evening, 78 state and local public health labs in 50 states and the District of Columbia have successfully verified and are currently using COVID-19 diagnostic tests. But your concern and mine is that we have to expand these opportunities, and we have to be able to get the results in a more rapid fashion.
All right. Thank you for the question. And we'll go to Terry in Bloomfield, who has a question about
if I could just
closures.
follow up, Terry, before you go, I just wanted to add that the Connecticut DPH, Department of Health State Laboratory, has confirmed that 6 people in Connecticut have tested positive, 4 in Fairfield County and 1 in Litchfield County, and 1 New York resident. So far, a total of 95 individuals have been tested at state laboratories, 89 negative and 6 positive.
All right.
Go ahead, Terry.
Terry from Bloomfield, you're live with the Congressman.
Hi. As you stated, my name is Terry West from Bloomfield, Connecticut. The question I have is, if your children are at home from school, the schools are closed, is there going to be any type of compensation for the parents for daycare?
Could you repeat that again, Carrie? I'm sorry.
Okay, that's okay. If the children are out of school and the parents have to work, is there going to be any compensation for the parents for daycare?
We are voting this evening on a paid leave program for those who have to take leave, both in terms of spreading the virus due to illness or providing or have caregiving responsibilities. And it will require all employers to provide immediate sick leave during this public health crisis, which, as you're probably painfully aware of, is a current pandemic.
Okay, thank you so much.
Thank you.
You're welcome.
Okay. And now we'll go to William, who has a question about the proper number to call if you have a question about coronavirus. William, you're live.
Okay, I'm a senior from Glastonbury, Connecticut. And my question was, as the emergency and the coronavirus spreads, is there going to be a reverse 911 implemented throughout the state to inform residents of the seriousness and also local quarantine issues or extensive, a larger outbreak than they would hear on the news? Thank you for taking my question.
It's an excellent question, and what we're telling people to do is to call, to your point, 211. Also, this is a question that the Connecticut Department of Public Health will answer, and I believe, as I said at the outset, we gave a number for that, and we will gladly send that back out to everyone as well.
All right. We'll go to Rose, and Rose, you're live with the Congressman. If you can just tell us what town you're calling from as well.
Yes. I'm calling from Bloomfield, Connecticut.
Well, hello.
Hi there. How are you? My concern is that the process of showing symptoms to having a person call in but not getting tested, that does not put them on the list for having the virus, but several people that I've heard already are not complying or honoring the staying home. And I'm hearing from the governor on the news stations, he's saying, well, once you have the symptoms, you should stay home. Is anything being done to enforce that a little bit more so that these people who have not been tested but may have the virus are walking around spreading it to several people?
Well, it's a great question, but clearly the governor can implore people just like you would if you had, and we constantly say this here, and I'm sure most employers do, if you're sick and have a cold, forget the coronavirus. You have the flu, as you point out, I tell my employees to stay home. And today with technology, and my understanding is the governor is setting a great example by saying state employees ought to consider working from home because we have the technology to do so. Our offices will be mandating, instead of having meeting in the offices, we'll be having telemeetings as we deal with this crisis, because what we want to do is eliminate the spread. And you can call the Department of Public Health, and they can order someone quarantined if they believe the person has is showing up at the test. But again, that would take the person having to identify that.
Thank you for the question. We now have David from Rocky Hill. You are live with the Congressman.
Hey, Congressman Larson. I have a question for
David?
you. Should people panic or be nervous because of the coronavirus?
No, they should not panic and they should not be nervous. They should be cautious. They should be aware. They should stay tuned, and they should take every precaution. In talking to all of our experts here, again, this is a virus like we've never had to deal with before, especially the way that it spreads. We know what's happened in Italy, for example, and which is why the president last night put a ban on travel. We know that, and the reason why you see the limitation on crowds, and for example, the cancellation of the St. Patrick's Day parade this weekend in Hartford, is that it spreads amongst crowds and usually is airborne. So what they talk about is keeping social distance, I like to call that the Heisman, between people, and recognizing that this disease, as been said, is probably going to spread, and the situation is going to get worse. So knowing that, why would you go into harm's way and be in a large crowd or flirt with danger? So, but taking the ordinary precautions of washing one's hands and making sure that you're avoiding contact with large groups of people it's a common sense way to address this issue. And I do think that once this country becomes focused like it is now, that the process hopefully will speed up. But in the meantime, why our labs, why our pharmacies, why our scientists are hard at work, why our healthcare professionals are focused, we as citizens have to exercise common sense and not exacerbate the problem by stepping into harm's way when it can be avoided.
Thank you. We'll go to Sarika from Bloomfield, who has a question about Social Security offices. You're live with the Congressman, Sarika.
Hello, Congressman Larson. I have a question. Coming as an employee from Social Security, I just wanted to know your take on how are we going to deal with people coming into our office. We see people face to face, and we don't know who's coming in, and we don't know who they're being exposed to. So I just wanted to know your take on that.
Well, first and foremost, we would recommend, because the Social Security Administration is going to be in charge of a lot of administration, that there will be contact with people, but we hope most of that contact will be via the phone. We, in fact, have a bill that's a moratorium on field closures, because what's happened is we have closed so many field offices that everybody gets funneled to one place, and that creates the kind of problem we're trying to avoid. So we want to keep our offices opening, but we want to make sure that we move more to dealing with people via the phone. And the first steps we tell people are to stay at home, to contact their healthcare professional. If you don't have a healthcare professional, which in some cases that's true, that you call the number we've provided for you, and so that you can call that number at 860-972-8100. That's a 24-hour hotline, or the emergency number, which is 211. And they will then direct you. And then if they are telling you to go to further contact Social Security, that we would suggest that they do it by phone. And I think the Social Security Administration will be following through with guidelines on that as well.
Thank you.
We have a question from Janice, who has a question about seniors. Janice, you're live with Congressman Larson.
Janice?
Seniors have lost our retirement income in the stock market. I'm wondering if this going to be
Janice,
some
I apologize.
kind of...
Can you start from the beginning? I think we caught your question midstream.
Okay.
Sorry, but you're live with the Congressman now.
Okay. Hello, Congressman.
Hello.
Hi. A lot of seniors have lost their retirement income in the stock market. I was wondering if there's going to be any assistance or relief for them.
Well, we have put forward in Congress a bill called Social Security 2100. And the sad truth here, Janice, is that after 2008, after the Great Recession, 90% of all Americans have not recovered their wealth and assets. Now, for the 10% that have, that's terrific. But for the 90% that haven't, the good news is that during that time, Social Security never missed a payment. But the bill that I propose would enhance Social Security. Why? The last time Congress did anything to enhance Social Security benefits was more than 50 years ago. And the last time they made it sustainably solvent was 37 years ago. So what I'm calling for is a 2% across-the-board increase for all Social Security recipients. And then to make sure that there's a COLA that reflects the actual costs that seniors experience when they're on Social Security. Heating and cooling your home, gasoline to get back and forth wherever you're traveling, visits to your doctor, your pharmacist, your nutritionist. These are things that impact people's daily lives. And then also making sure that if you continue to work because you have to, that your Social Security isn't taxed like it is currently under our old system. So, and also providing that no one who's worked all their lives and retires and paid in their quarters can retire into poverty, as is the case for over 5 million Americans currently. So we're hoping to get that bill through the House of Representatives and the Senate. And this, by the way, as many economists have pointed out, would also be a great incentive for economic development, because the money you receive from Social Security is spent right back into the economy. Nobody hoards their Social Security benefits, and that's why we believe strongly, and I continue to push for expanding Social Security benefits, not keeping them steady, but expanding them and making sure they're not only there for this generation, but all future generations.
Thank you. Let's go with Andrew from West Hartford. You're live with Congressman Larson.
Good evening, Congressman Larson. I had a question about, obviously there's a lot of divide and bipartisanship these days. I guess just seeing that this is going to affect everyone equally, I'd be interested in what you're going to be doing to work on a bipartisan basis to try to solve this pandemic.
Well, I think people would be pleasantly surprised that the work that's currently going on, to your point, disease does not differentiate between Democrat or Republican or independent. I mean, this is something that impacts every single American. And we continue to try to work across the aisle. And I was just talking with Steve Scalise today from Louisiana about the continued work that we need to do. Later this evening, we will be passing a bipartisan bill, and there are many ideas that exist out there how to solve the problem, and I think you're going to continue to see different tranches of ideas, but at the end of the day, we have to continue to be supportive. You don't hear me criticize the president. I think that they should have reacted quicker, etc. But we're all in this together as a nation, and we've got to fight this collectively, and we've got to make sure that everybody pulls together on behalf of the American people to get this done. And so the legislation that I've introduced, we always seek co-sponsors to that legislation from both sides of the aisle in order to get it done. And to your point, that's the only way for us to work in time of crisis is together. And I've had the experience of being here both after September the 11th, when that happened, and after the great crash, when that happened. And in those cases, in both times when there was a Republican administration, and now, we always, as a nation, pull together. The important thing here is to help out all Americans. Your political affiliation doesn't matter and should be left at the door.
Thank you. We will go to Doug in West Hartford. Doug, you're live with Congressman Larson.
Hi, Doug.
Oh, unfortunately, I think Doug may have dropped off before we were able to take his call. We'll go with someone else then. We'll go with Donna, who has a question about healthcare workers. Donna, you're live with the Congressman.
Hi, this is Donna from Wethersfield. Thank you, Congressman Larson, for taking my call.
Donna, nice to be with you.
Thank you. My question really is probably from healthcare workers' concerns in terms of looking at this virus and for them being required to be able to be taking care of people in hospitals, healthcare facilities, specifically group homes where they may have to care for people with the coronavirus, and their concerns about, even though they may take all the precautions, about bringing this back to their families at the end of their shift. Is there anything being considered about how we can deal with these workers and what we may think about, their role here?
Well, first and foremost, and I'm assume, as you indicated, you're one of them, you are on the front lines of battling this. And so starting with, we say to people, do not go to the hospital, do not go to a nursing home, stay at home, first and foremost, contact from your home your healthcare professional, and if you don't have one, then the appropriate healthcare clinic. Then, with regard, and the CDC has said this, with regard to masks and gloves and equipment, first and foremost, all federal dollars and efforts will be directed at healthcare workers because it's their health and their vitality as caretakers that we have to maintain and make sure that we're giving them all the vital assistance that we can, because this can quickly, as we've seen in other countries, overwhelm a state or a a community. And so the frontline workers, it's kind of like a first responder, like a firefighter or a police officer, et cetera, have to, that's where we need to make the investment in equipment, in protection, and in terms of utilizing where we can auxiliary efforts. I mean, you've probably read or heard about what Governor Cuomo has done in New York and New Rochelle, but I think also where necessary, the governors and local officials are going to have to come in and augment the efforts of our healthcare providers and the persons that are on the front line. But America owes you a gratitude, but most importantly, they owe you and your families the extra added measures that you're safe and you're protected and you're compensated.
Thank you, Congressman. We'll go with Karen, who has a question about schools. If Karen, you're live with the Congressman, if you could just state what town you're from.
Hi, I'm from Portland, Connecticut. Thanks so much for providing this forum tonight.
Well, thank you for participating. How can we help you, Karen?
I'm a high school special education teacher, just like the first question, Ken, I think it was. Right now what we're seeing in Connecticut is a real patchwork of school closures with the decisions being made at the district level.
Right.
Governor Ned Lamont just waived the 180 school day requirement to ease the burden on districts making those decisions. I'm wondering if at any point as cases increase and the virus spreads, if you foresee any federal mandates for school closure akin to what Italy's done?
My guess would be probably not, because this is a state and local municipal decision that has to be made. And we want to make sure that rather than a broad federal mandate, there are exceptions to every rule, but the states and the local municipalities are better equipped to make those decisions because they have the on-the-ground knowledge of what's going on in the local school or the local school district, and we would hope that they would respond accordingly. And then it's the federal government's responsibility to make sure that we back up those states with the kind of funding that they're going to need with regard to loss of time and making up for particular circumstances and other leave opportunities that might have to be employed. But this will require, as you pointed out, a working together of local, state, and federal officials. But the decision with respect to closure is that of the local municipality and the state.
All right, and we'll go with Doug from West Hartford, who I think we tried before, but he's gotten back on. But Doug, you're live with Congressman Larson.
That's great. Thank you so much. That was me. I hung myself up. Congressman, I'll echo what we just heard. Many thanks for your willingness to host this and future Tele town halls. It's really helpful for folks. Hey, what can you tell us about the development of a vaccine that'll help this situation in the future?
Well, yeah, this is a great question, and it's certainly one that has prompted both a lot of concern and this is an area where I believe you have to rely on the scientists in our labs. We're assured by Dr. Fauci that vaccines are currently being developed, but they're cautious in saying they won't likely be ready for about a year to maybe a year and a half. Now, we've heard varying reports that it could happen sooner than that, but some vaccines may be ready for clinical trials on humans, they say as early as the next few weeks, but they are optimistically cautious about this. Treatments are being developed and tested, including something that's called the remdesivir, developed by the U.S. company Gilead. Initially, it was developed for Ebola, which is having positive results around the world and now being used in Washington State under the FDA's Compassionate Care Program, meaning they've provided an exemption there. Several other biotech companies are also working to find treatment for the new coronavirus, including pharmaceutical giants Johnson & Johnson and GlaxoSmithKline, for example, are also working on vaccines. AbbVie has said that it has seen promising results from combating COVID-19 using a mixture of two of its HIV medications and Tamiflu, an antiviral drug for treating the flu. They say that the treatments will be available sooner than the vaccine, and that's we view that as promising also. But they are cautious in terms of saying that with regard to an overall vaccine that pass all the FDA requirements, probably is more likely about a year away. But again, as I said earlier, this is the United States of America, and when we put our minds to it and our resources and focus on coming up with what is a national and frankly a global crisis, that we rely on our best minds, our best universities, our scientists to come up with that solution in a manner in which also that the public will not be gouged and that we will find this solution. I'm confident that it will happen and that we all pull together to make sure that that's the case. And in the meantime, follow common sense advice that our healthcare officials are providing. But it's an outstanding question. I wish I could give you a more thorough answer than what I've provided.
Thanks, Congressman. We've got Sue from Wethersfield. Sue, you're live with the Congressman.
Thank you very much, Congressman Larson. I echo the comments. I truly appreciate you taking the time to speak with us. My question is, when we have a severe weather event, I believe the governor has asked large employers perhaps to encourage people to work remotely if at all possible. And I work for an employer in Massachusetts who today actually instructed those of us who could work from home, and largely almost everyone at a large insurance company, to work remotely. Has anything been considered in Connecticut? Again, I appreciate all the proposed bills for, the financial assistance to people to take care of sick people, but anything to encourage large employers to have people work remotely, get them out of the close contact at work?
There's no government mandate that we know of yet to do telework, but I would say, as I don't know if you were on earlier, that the state of Connecticut and currently is encouraging people to work at home. We've heard from a number of business roundtables and other discussions that this is going on. And again, I would add that I think this is a common sense solution to a problem. Now, there are circumstances, if you're a welder and a machinist and you're putting together an aircraft engine, it's pretty hard to do that from home. But if you're as you indicated, an insurance employee or whatever, there is an opportunity through technology for us to work from our homes, and government will continue to encourage people to do that, but there is no specific government mandate to do that yet. We hope that people will follow the common sense practices that have been outlined, and certainly would encourage people to do so, and certainly encourage employers to do so as well.
Thanks, Congressman. Karen from Kensington has a question. Karen, you're live with Congressman Larson.
Thank you. Hi, Congressman Larson. This is Karen Pagliaro from Berlin, Connecticut. Thank you so much for what you're doing. I truly appreciate it. As a nurse in home care, I've been hearing very many people voicing concerns about the needed PPE that we need to wear and to utilize when we go into the homes. And it can be something as simple as hand sanitizer, the N95 masks, and isolation gowns. What can the government do to help us get these needed supplies to keep our employees safe when they make visits to people who do have COVID-19 and are in their homes?
Well, thank you for the question. And clearly, what we believe the federal government should be doing is sending to the states the appropriate gowns and masks that you alluded to, so that we're protecting our frontline defenders, people like yourself and others who are healthcare providers and professionals who come in contact with people with COVID-19. We want to make sure that every precaution is taken, and make sure that we're equipping all the states with everything they need. The CDC has also said that this is less a concern for people who don't have the virus, who are otherwise healthy, that there is not the need for masks and et cetera if they follow the procedures of washing and cleansing and avoiding crowds, that those produce the greatest results. And make sure, because not all masks, as you're aware of, but a lot of people are not, are geared to prevent the spread of disease. So what the government is focused on is funding our frontline and healthcare professionals with those specific masks that are designed to shield the COVID-19 virus, and also, as you pointed out, the kind of gowns and other aspects that will assist our healthcare providers with everything they need to continue to do their job and receive the most protection they're going to do. We're coming up on probably having to take just one more question, because we'll be voting shortly in the Congress. I want to thank everybody. It's been about an hour, and I want to thank everybody for being on the line. And as I indicated, we're going to do these as frequently as necessary, and have scheduled one for Monday so that we can continue to bring updates to you as things progress, as more money becomes available, and as we field more and more questions. I would also add that, as is the case tonight, we get an awful lot of common sense, straightforward questions, and far from just listening, we take copious notes and try to turn those things into action, and again, work bipartisanly, but also work across both local, state, and federal governmental entities and their agencies to make sure that we're coordinating an effort that can be most successful for the constituents we serve. And with that, we'll take a final question.
Thanks, Congressman. John from Rocky Hill has a question. John, you're live with Congressman Larson.
Hello, Congressman Larson. Thank you for the opportunity for the question. Considering during the 2 to 12 day of the incubation period for folks where they're still able to be infected, on a worst case scenario, at what level are we prepared capacity-wise, such as fluids, medication, beds, etc.? Are we able to deal with an exponentially increased of incidence of the serious illness? In other words, what is the percentage of available resources to people in Connecticut?
Well, thank you, John, and that's precisely why we're working directly with the President and why we're directly voting on these issues today, because we have to be prepared for the worst case scenario. And we will work directly with the President and the House and Senate in order to make sure that we are prepared. I would be the first to say that we should have been better prepared, should have had more diagnostic tests available. But having said that, the time for talking about that is over. We're in the midst of a crisis. We have to roll up our sleeves, put our shoulder to the wheel, work with the President, work, as several callers have indicated, bipartisanly, bicamerally, House and Senate, and with the President, to get the job done, to make sure that we don't find ourselves in a situation that Italy has found itself in now, and to get out in front of this, even though we're a little behind, this country, when it sets its mind to anything, we put a man on the moon. They said it couldn't be done, and they said it would take years to do it, but we had a president with a vision and a Congress that got behind him, and when we do that as a nation, there's nothing that we can't do. We will, as a nation, solve this problem. And it will happen because of a concerned citizenry that follows common sense concepts that are put together by our healthcare providers and officials, our doctors and scientists, and frankly, even the advice of our mothers, who all knew best. And then with the science, technology, and capability and focus of a nation whose only concern should be eradication of this dreadful disease. And with this, again, John, thank you for your question, but that's always how a nation should respond in crisis, collectively and together. And with that, I want to thank everybody who's been on the line this evening and assure you that the entire Connecticut delegation, both Senate and House, is working tirelessly to make sure that we produce the kind of results that will be most beneficial to our towns and communities, the state of Connecticut, and in fact, the entire country. God bless you. God bless America. Thank you for being with us tonight.
Thanks, Congressman. And just a reminder, if we weren't able to get to your question this evening, you can leave a voicemail after the event. In addition, you can always contact our office. Our Hartford number is 860-278-8888. Our Washington office is 202-225-2265. And you can visit our website at larson.house.gov. Thanks so much, everyone, and have a great evening.